Hello friends, welcome to Dezinlife. Friends, in last 6-7 years, the overall respect of the armed force in the eyes of the general public has gone up. There are many reasons for that. For different promotion has been like this, or different the government has lauded the armed forces like that, or maybe media also highlighted in that way, which was not the case some 6-7 years back. Same way, in last 4 months, the respect for the government doctors or the government paramedical staff, it has also gone up in the public eyes due to corona, because they have suffered a lot and they are serving the people. The one more set of the people, they say our police. The respect of police has also little bit improved, not completely, but what the respect of police, or what is the image or perception police used to be there 4 months back, today they stand better because of their service in the corona time. You may be thinking why I am talking all that. The reason of all talking is that because I hope that one day field pharma professional also, their respect or their image will also go up, because the nature of job the pharma field professional do is nowhere less than the armed force. They go through the risk of the road accident because every day they are on the road. They pick up the disease due to outside food which they have to take. They pick up the disease due to excessive exposure they have to hospitals. They pick up the secondary infection from there. They face a big weather onslaught, whether it's a summer, whether winter, or whether it's a rainy season. And at the top of that, they face the humiliation also, whether from the customer side or whether the internal pressure. Now again, in the corona crisis, if the field professionals has to survive, they have to go and field and work. So there is no other option before them but to go to the field and again face the same onslaught, go through the same hard work which they used to do without much of appreciation. So I want to today suggest some basic working habit which they can inculcate in their routine for at least next few months, which can help in their safety. And more so reason is there. Last week there is a report of some death of the pharma field professional, which was very sad event, and there has been some news of the infections also picking up the pharma professional. So we need to move with the more caution. So I'm going to suggest you 10 different things which you can inculcate in your working habits. My number one suggestion is there that you should always travel with your private vehicle. Don't travel with the public vehicle, because you have to go to access station, out station, or even within city also. More you travel with the private vehicle, more safe you are. My second suggestion is using the mask. You should use N95 mask, because it is for the paramedical staff and you are also paramedical person. Or if all that is not possible some reason, at least 3-ply mask, but certainly not fabric mask. Fabric mask is basically meant for the jogging or walking or maybe at your home, but not certainly for the kind of work you do. To use at least N95 or 3-ply mask. And along with that, use a face shield also. Suggestion number 3, don't become part of the crowd anywhere, wherever you go, and whenever you see any crowd, don't go there, don't be part of that, keep social distance. And number 4, friends, if you have history of the high blood pressure, diabetes, kidney or the liver ailment, or otherwise any other weak immunity, take a break. There is nothing wrong in the taking a break, and there is nothing wrong, or you can say nothing more important than the life. Jaan hai to jahan hai. And my suggestion number 5, do not wait for the doctors at the waiting room, or don't sit for any reason in doctor's waiting room. Wait outside. It makes a lot of difference and can avoid you picking up any infections. You sitting outside or standing outside, you can always keep a watch in doctor's waiting room when the patient is coming out, and you can immediately go in, but don't wait doctor's waiting room. Point number 6, keep your call, keep your interactions very brief. Whether interaction is with the doctor, whether it's with the chemist, whether it's with the stockist, all the interactions should be very brief, nothing more than 5 minutes at the most. And if you can finish it off early, maybe 2-3 minutes, it's nothing wrong, nothing better than that. Suggestion number 7, keep your working hours short. Preferably if you can work in the 2 shift, morning and evening, take a break, but don't keep a long working hours. More outside you are, more exposure you have, and more is the risk. And there also with very point to point working, which time you are going where, and accordingly you should move so that you are more safe. Suggestion number 8. Don't push yourself for 10, 12 call or 15 call per day, which was the old thing. In next few months, do whatever possible, whether you're able to make 6 call, whether 8 call or 10 calls, because at different places, doctors are also not giving calls so frequently. But don't compromise on your keeping the short working hours for the sake of making a X number of call. This less number of call, which are your more important doctor, your more important customer, meet them so that your productivity goes up, but your working exposure hours get reduced. And suggestion number 9, friends, carry your own water bottle. Don't look for water outside, because full day you have to drink the water. So carry your own bottle. Suggestion number 10, keep a small soap with you and wash your hand wherever possible, wherever you see the water, because hand washing is far better than the use of the sanitizer. It does not mean that you should not keep a sanitizer, but you keep a sanitizer also, but hand washing is better than sanitizer. So wherever possible, wash your hand. And last, after the even 10th also, don't shake hand with anyone. Keep a distance and make your customers comfortable. Once you don't shake hand, you keep a certain distance. Your doctor will be comfortable, your chemist will be comfortable, the stockist will be comfortable. Mate, what you say is the 6 gaj ki duri, or maybe 1.8 meter comes to, or say 2 meter. So while making the doctor call also, keep with the little distance. While making the chemist call also, speak from the little distance, or in case of stockist also. So keep distance, don't shake hand, and make yourself comfortable, yourself safe, and your customer also safe. So friends, I wish you all the best for this corona crisis, and please do take care of yourself. Thank you.